Today's topic is medication, prescription medication. So some of you have psychiatrists that prescribe your medication. Some of you have primary care doctors. Some of you have physician's assistants, and some of you have nurse practitioners. So all of these people can prescribe mental health medications. If you're using what's called a physician extender, that would be a PA or an NP. Something to bear in mind is that they are practicing under a different doctor's license. So they don't get to make decisions about the types of medication they prescribe. The good thing to ask when you're starting, if you're starting with a physician extender, is does your supervising physician allow you to write prescriptions for all medications, or are there limitations on which you can prescribe? This is super important. We spend a lot of time trying to find good fits when it comes to prescribers, and finding a prescriber that has worked with a lot of people on the spectrum and has prescribed a lot of medications and seen how they do or don't work is really important. So if you are getting a new prescriber, I can't really make a recommendation because I'm a nurse and we can't do that, but personally I would never work with, maybe not ever say never, I would be apprehensive about working with a NP or a PA who has restrictions based on what their supervising physician will allow them to prescribe, because they can't write a prescription for what they think is most effective or most helpful. They have to go against their gut sometimes because it's not legal for them to do prescribing outside of what their supervising physician thinks is okay. So this is something to keep in mind and something to ask your provider if they are a physician extender.